123.
Okay, how do you feel?
Not terrible.
Okay. Do you want a break or do you want to keep going?
Let's keep going.
Okay.
Hi, my name is Mackenzie Huck. I am a patient storyteller here at Madonna. I've told a lot of stories over the last 2 years, but it feels kind of weird being on this side of the camera as a patient. So I had COVID in April of 2020 after a trip to South Dakota. I had all of the symptoms, the headache, the cough, the fatigue, even the loss of my taste and my smell. But even after that initial infection, other symptoms just kind of kept popping up.
So there's a wide variety of symptoms that some people are presenting with. Many of the symptoms we see involve problems with attention, feeling like their cognitive status is somehow impaired. This may be affecting them at work. We also see people that are having problems with exhaustion or fatigue and just having no energy.
My heart would race, even if I wasn't doing anything, even if I was just sitting on the couch watching TV. And when I would go up a flight of stairs, it was brutal. I was just getting so winded. And my primary care physician referred me for a heart monitor and a pulmonary function test, but both of those came back normal. So then I started to kind of wonder, maybe this isn't post-COVID. Maybe I'm just really, really out of shape.
Many people have symptoms that may not manifest as significant abnormalities on those types of tests. But if you're having symptoms that are bothering you, that are interfering with your quality of life or your ability to function in your job or your daily routine, that's certainly something to take up and be seen for.
After chatting with Dr. Berner, I thought to myself, what do I have to lose? So I had an initial evaluation with physical, occupational, and speech therapy, and I still had some of that imposter syndrome. I passed all of the tests that they gave me.
What we're seeing with this population a lot of times is objectively, they're scoring really well. So you feel the brain fog, but you do a test and you think, oh, well, I actually did well on it. Although sometimes the objective scores look good, we kind of have to look at the whole picture.
This will give you a good starting point.
So in speech therapy, I've been doing a quality of life scale with each of my post-COVID patients, both at admission and then at discharge. And it's a subjective assessment so that they can kind of score themselves on a scale of 1 to 5 of if they're able to carry out these communication tasks and life tasks. And I think it's really important because it helps show these patients that what they're feeling is valid and that, these simple tasks that they're used to completing are taking a lot more energy or stress. It's also awesome because it has shown a lot of progress to my patients.
After, a couple weeks of therapy, I started to notice I wasn't getting winded walking short distances. I felt like I could concentrate on things easier. And overall, I just had more energy. I didn't realize how much I was missing out on just because I was so exhausted. It was really surprising to me that these simple techniques, these interventions, could have such a major impact on my quality of life.
We want to provide those tools and strategies to these patients. What do you have to lose with gaining some new strategy development or tools for your toolbox? If they're going to help you even a little bit, that's better than where you're at.